Okay, hello, and welcome to Medicare 101. My name is Stacia McKeever, and I'm an adult and teen librarian at the Joseph E. Coleman Regional Library that's located in Germantown. And today I'm here with Joan Adler. She's a certified Medicare counselor with APPRISE. And do you want to tell us a little bit about what APPRISE is, Joan?
Yes. Can you still see my screen?
I can.
Okay. So SHIP is the State Health Insurance Assistance Program, which is funded by the federal government, and it goes out to the states through the state agencies on aging. And each state has the ability to name their program something cute. And in Pennsylvania, the SHIP program is called APPRISE. In Florida, it's called Shine. But it's really what we do is we help counsel people about Medicare and what their choices are, and we help them get plans. We assess them for low income programs and other sorts of programs as well. And we are pretty well known in the area, but not well enough. A lot of people have to watch Joe Namath on television and call all these numbers of these dodgy places that are trying to sell them things instead of doing a not-for-profit, unbiased assessment of what they really need and help guide them to picking what's going to work best for them. So this is who we are, and this is who I am. And what I'm going to do is run through a counseling session like I usually do for clients. And anybody who wants to ask me questions should feel free to ask me questions or put them in the chat. And then after I go through an overview, I usually go on the internet to show people how we actually work with the Medicare.gov website.
That sounds
So,
great.
okay, so the first thing I'm going to do is share a pamphlet that's called Quick Look at Medicare. And this is what I'm going to make it a little smaller. We're going to take a quick look at Medicare and look at the parts of Medicare. Now, most of you know that Medicare is health insurance for people over 65, but also people who are on disability become eligible for Medicare when they have been on disability for 2 years. And people of any age with end-stage renal disease, which means they have kidney disease and they're on dialysis, they're eligible as soon as they fall into that category. So there are 3 parts of Medicare. Medicare Part A is all of your hospital coverage. So it includes everything that goes on with you in the hospital. It covers skilled nursing care. It covers hospice at the end of life, and it covers some home health care. Part B is your medical outpatient insurance, and it covers doctor's visits, specialists, any outpatient care or procedures, covers some home health care and a lot of preventive services, and it also covers any medical equipment that you might need. And the third part of Medicare is the drug plan, which is called Part D. And sometimes that's included with the rest of your plan and sometimes not. So the Part C is what Medicare Advantage plans, which are HMOs, they call themselves Part C because they include A, B, and a drug plan, and somehow they add that together and they think that's Part C. So when you go on Medicare, your main decision is whether you're going to take original Medicare or get a Medicare Advantage HMO. Now, the HMOs all have networks, which means that when you see a doctor or a hospital or go for an x-ray, you need to be sure that that place that you're going is in the network for your Advantage plan. Otherwise, you'll experience higher copays if you go somewhere out of network. In addition, some of the HMOs require you to get a referral from your primary doctor before you can see a specialist. But Advantage plans, like original Medicare, both cover Part A and Part B. And then the Advantage plans include your drug plan with the plan. On the other side is Original Medicare. And Original Medicare includes Part A and Part B. And again, that's the hospital and the outpatient. And Medicare covers 80% of those expenses. And then how do you pay for the other 20%? Most people purchase a private insurance Medigap Supplement. Now, sometimes the Advantage plans call themselves a supplement, but they are not supplements. The only supplement is a Medigap, and that pays the other 20% that Medicare does not cover. And then in addition, you have to get a drug plan separately to add to your complete coverage. Now, the Original Medicare has no network, which means you can see any doctor that you want to make an appointment with as long as they accept Medicare. And you don't need a referral, you don't need anybody's permission. Any hospital, lab, x-ray facility that accepts Medicare, you can just go in, make your own appointment, and be seen. And the Medigap follows Medicare, which means that even if you get a Medigap from let's pick an insurance company, Aetna, that doesn't have a network. It doesn't have the Aetna network. Then whatever your Medigap is will automatically pay the 20% after Medicare pays the 80%. Now, I think I forgot to mention it, that people who are working when they turn 65 and they're covered by a group health plan, they don't have to enroll in Medicare. They are getting a complete coverage as long as the employer has more than 20 people. You can wait and don't have to enroll with Original Medicare as long as you're covered by a group health plan. The people who need to enroll when they turn 65 are people that don't have other insurance. And the initial enrollment period includes the month that you turn 65, and it includes the 3 months before that and the 3 months after that. And that is when you have to sign up for Medicare if you are not covered by a group health plan from work. If you are covered and you get a card from Medicare and it has Part A and Part B, you need to cancel the Part B because you're going to be paying for that, and you don't need Part B when you have a group health plan. So what are the costs? So the costs on this side, if you've been working in the system and paying into Social Security for at least 10 years in this country, your Part A is free. That means all your hospital coverage is free. Your Part B always has a monthly premium, and this year it's $148.50. And for low-income people, the state of Pennsylvania will pay your Part B premium. Then if you go to get a Medigap, you pay a monthly premium because it's a private insurance company, but they have to follow Medicare. And we'll talk about the costs for a Medigap in a minute. And then you have to pay some sort of premium for your Part D plan and some co-pays for your medicine. So when we sign you up for a plan, we enter all of your drugs into the computer, and then we look among all the drug plans that are offered to see which one will give you the best deal. So let me see. I think that's about, so the other thing is that your Medigap, if you're going to get a Medigap, you need to get it during the first 6 months that you have Part B. Because during the first 6 months of your Part B, you have what's called a guaranteed issue, which means that the insurance companies have to sell you a Medigap plan at the cheapest possible rate, and they're not allowed to ask you anything about pre-existing conditions or about your health. The only thing they're allowed to ask you is, do you smoke? And we will go over this a little bit when we look at the prices. So while we're on the Medigap side, let's look at the Medigap plans. So can you see this, Medigap plans?
Yes.
Okay. So these are the plans that are currently in existence. The C and the F are no longer being sold to people coming onto Medicare after 2020. But if you have any plan, if you're older, if you know somebody that has an old plan, like a J plan that doesn't even show up on here, as long as they're paying their premium, they will still keep whatever plan they signed up for. It's just that the new plans that are being sold are going to be the A, B, D, G, K, L, M, and N. And the best plan out of all of these, the ones with the most coverage, is the G plan. And we'll go over what it covers. And then the N plan is the second best. It covers just about everything that the G plan covers, except it's a lot cheaper. And you have to pay $20 every time you see the doctor, regardless of whether it's your primary or a specialist. And you have to pay $50 when you go to the emergency room. So what does it pay for? So let's start with the Part A. So the Part A is the hospital expenses. So the hospital, if you go in under Medicare, original Medicare, they usually want to charge you this year $1,484 each time you're admitted to the hospital. But if you have a G or an N plan, that's completely covered. Now, Medicare will pay for your first 60 days in the hospital, but if you have to be in longer than that, there are pretty big copays that come down the line, but the G and the N cover those copays completely. If you need blood in the hospital, the first 3 pints of blood are covered by these two plans. And if you have to go to a skilled nursing facility after the hospital or separately from the hospital, Medicare covers you for the first 20 days, but after 20 days, there's a big copay, and the G and the N both cover that copay completely. So now let's talk about Part B, outpatient services. So everybody has to pay their annual deductible every year for Part B, and this year it's $203. So that means the first $203 worth of services on original Medicare come out of your pocket. And after that, your Medigap plan covers the rest. So what do they cover? So any coinsurance for doctors, labs, x-rays, outpatient procedures, and any medical equipment, Medicare pays 80% and your Medigap covers the other 20%, with the only exception of paying for the doctor in the emergency room. But the N plan will pay for the 20% for your labs and your x-rays and your medical equipment and your outpatient procedures. So what else gets paid for? So Part B, and your Medigap cover 100% of coinsurance for all your preventive services, which includes screening and diagnostic sorts of things like screening blood work, any kind of screening test the doctor does, colonoscopies, mammograms, and many of the vaccines are covered 100% by your Medigap and Medicare. And then at the end of life, Hospice Care, this is a Part A service I forgot to mention. If you need to go into hospice at the end of life, the G and the N plan, Medigaps, cover all of your copays completely. Now, some people know that Medicare does not cover you when you leave the United States. So the Medigap also will cover 80% of any emergency care that you need when you're outside the US during the first 60 days that you're on a trip. And they do charge a deductible and there's a lifetime maximum, but it's good to know that if you take a trip to Europe and you have some kind of illness, you need to see a doctor, you will have coverage outside the US. The only other difference is a very minor difference in Part B excess charges. So in many states in the United States, doctors and hospitals are allowed to charge you an extra 15% out of your pocket above what Medicare pays them. And this becomes an issue, not in Pennsylvania, because in Pennsylvania, doctors are not allowed to charge excess charges. And there are 6 or 7 states where they're not allowed to do this. But if you go visit the grandchildren in Oklahoma and you get sick, the G plan will cover any of those excess charges and the N plan will not. That's the only other difference between the G and the N plan. So if you want to just take a quick look, these are the states that do not allow excess charges. And you see Pennsylvania's on that list. But Oklahoma, as I used for an example, is not on the list and they're allowed to charge you those excess charges. So you may want to know how much these plans cost. And I'm going to tell you right now, but then later we're going to go in and look at it. So for a 65-year-old woman who gets a G plan right now, you should expect to pay about $130 something for a good plan. And for an N plan for a woman, you should expect to pay about $100, give or take $5 a month for an N plan. So it's about a $30 difference. And you have to put that up against the how many times you'll see a doctor and what the cost for that will be. But you'd have to see at least 2 doctors every month in order, to make up for what the G plan covers. But a lot of people like to get the full coverage of the G plan anyway. So those are the approximate costs, and we'll talk about that later. Now I'm going to stop sharing the Medigap, and instead I'm going to share information about the Advantage plans. So just to remind you, the Advantage plans are the HMOs on this side of the equation. Up until now, we've been talking about original Medicare and the Medigap, but now we're going to talk about the HMOs. So let's look at them. Can you see these?
Yeah.
Okay. So these are Medicare Advantage plans. And I forgot to mention that Medicare covers you in all the 50 states. And the Medigap follows Medicare and covers you wherever you go in the United States. These Advantage plans are all county specific. So they're different plans in every county. And if you go outside the county, your plan may or may not have a doctor that you can see if you're in another part of the US. And a lot of that depends upon whether they're a national company or whether they're a local company. But you need to know that if you move outside of Philadelphia, you need to get a new plan. So there are about 40 different plans, Advantage plans, that are around right now, but these are not them. I got the wrong ones. So let me stop sharing and open the right ones. We want the ones these. So this is where I'm saying there's about 40 different plans. So how do we decide what kind of plan? Well, you look at the costs and you look at the network, because I said they all have networks. So you want one that's got a good network in your area. So let's look at some of these plans, and we look at the monthly premium, the annual drug deductibles or health deductibles. This is your primary care doctor. This is your specialist visit copay. All of these have copays. This is the outpatient procedure rates, the inpatient, what you pay if you're admitted to the hospital, maximum out of pocket for a year, and all the extra perks that Joe Namath tells you about on television. So let's look. Here are the AARP plans. And they have 3 different Advantage plans this year in our area. And the first thing you got to look at is there's a 0 monthly premium. There's one that you pay $29 a month. There's one that you pay $58 a month. But this one, you have to pay $500 deductible before the plan kicks in. This one, you have to pay $200 for drugs before the plan starts. And this one, you have to pay almost $300 for your drugs before the plan starts. And then, even if you take the 0 monthly premium plan, you're paying $500 out of your pocket. If you go in network to your primary, it's $0, but if you see a primary outside, it's $45. If you see a specialist in the network, it's $35, but if you go outside, it's $70. The amount for an outpatient visit, you can't tell. And they charge you a flat rate of $750 out of your pocket for every hospital stay, whether you're in there for 1 day or 20 days. And all of them, you can look at the different prices, and we go over this with all of you. Here's a plan that charges $1,000 before it even kicks in. And the PCP visits should be $0. And the monthly premium should be $0, because a lot of these, even if you're paying, you're not really getting a whole lot more for paying. So I try to tell people, get a 0 monthly premium plan and save your money for your copays, because there will always be copays. And especially the older you get and the more you use services, you'll end up with a lot of unpredictable and potentially very expensive copays. And then in addition, the specialist visits can range from $25 a visit to $50. The outpatient visits can be as much as $400 a visit, a procedure. And the in-hospital costs can range anywhere from about $170 a day to $400 a day. And for all of this, they give you glasses, dental work, hearing aids. Some of them give you fitness. Some of them give you transportation. Most of them are now giving you worldwide telehealth. And many of them give you an over-the-counter benefit at the drugstore to buy Band-Aids and vitamins and ACE bandages and stuff like that. But if you look, there are a few that I highlight here because they're good in this area. And what do I mean by that? So Humana, you probably hear a lot about Humana. They're very famous. And if you lived in Florida, Humana is a great plan because they have a great network in Florida. However, in Philadelphia, they do not have a great plan. So I don't usually advise people to get them. So there are a bunch of other Advantage plans. These are Blue Cross, Keystone plans. There's Health Partners plan that's notable for the lowest in-hospital stay rate, although for the most days. And there are some Cigna plans that are pretty economical, but it all depends on what drugs you're on and what doctors you want to see and whether they're in the network. The other thing I wanted to say is if you go to the emergency room, currently the rate out of your pocket will be $95 for the emergency room. So these are all costs that you should consider. And if this were live, I would ask people if they had any questions about all of this. And I certainly can send out information to people. All of this is available online. I could email that to anybody. And this is a good time to mention that my name is Joan and this is my contact phone number. So if you're watching this and you want individual counseling, please feel free to call me. I don't always pick up the phone, but if you leave your name and number, I will call you back for sure. This is our APPRISE office at Einstein. You can also call this number. And like I said, if you contact me, I can send you out any of the materials I'm showing you here.
I have a question.
Yes.
When you mentioned low income, do you know what the mark is for that? Like you have to be within a certain range?
Okay, that's a really good question. So here is our 2021 Program Assistance Guidelines. So what that means now, if somebody is on Medicaid, which is $1093 a month, or $1,288 for a single person for the year, or $17,000 for a couple. If you're on full Medicaid, if you're at that income level, you're eligible for full Medicaid as long as your assets don't exceed this amount. And assets are anything you rent, property you rent, extra cars that you have, money in the bank, money in a checking account, money that you get as an inheritance. Those are your assets. They don't count the house you live in or the car you drive. Then if your assets are too high and you're still at this income level, all of these three categories, if you're under this amount, any of these categories, you are eligible for Medicare Savings, which means that the state of Pennsylvania will pay your Part B premium of $148.50. Then if you're too rich for this, but your income as a single person is less than $1,630 or a couple $2,198, you're eligible for something called Extra Help, which is a subsidy that helps you pay for your medications. And this is a federal program. If your income is above this and still pretty low income, there is also a program called PACE or PACENet that you can sign up for that also helps you pay for your medication. So when I say low income, this is the neighborhood I'm talking about. Now, there are also extra fees that you pay if you're high income, but I'm not going to go over that. That's something to talk about in an individual session.
Great.
So
oh, I'm sorry.
Go ahead. No, I'm here for questions.
Was there a deadline coming up that people should be aware of?
Yes, but people who are watching this on the recording will probably miss the deadline.
Oh,
So,
okay.
so aside from your initial enrollment period that I said, if you're not covered by work insurance, your initial enrollment period starts 3 months before the month of your birth. It includes the month of your birth, and then 3 months after the month of your birth. That is your initial enrollment period to sign up for Medicare. And you can sign up for an Advantage plan or for original Medicare and a drug plan. And then again, the first 6 months of your Part B is when you want to get a Medigap if that's what you choose. After that, if you want to change your plan for everybody, there's a thing called open enrollment, Medicare open enrollment, that occurs every year from October 15th to December 7th. And that's when you can change your drug plan or your Advantage plan. And then if you have an Advantage plan already, one of those HMOs we were talking about, there is an additional enrollment period, open enrollment for Medicare Advantage, which is now from January 1st through March 31st. And when you sign up in that period, your new benefit starts the following month. When you sign up in open enrollment, October through December, your benefits start January 1st of the next year. So that's a very good question. So right now we're in an enrollment period. If anybody has Medicare Advantage and they want to change their plan, this is the time to do it, because after March 31st, you will not be able to change again until October unless you have an income low enough for Extra Help or those other programs and Medicaid. Those people can change once every quarter. And we can do that for you. We sign people up for the Medicare Advantage plans and for the drug plans. And I can show you how we do that. That'll be the next thing we do. Are we ready for that? Okay, if it works, only if it works.
Let's see.
So the internet should be here, yes. And this should be Medicare.gov. So Medicare.gov is where you go to find out about Medicare, at least the basics. And there's a lot of information in these tabs. Tells you a lot about enrollment periods, how things work, how you submit a claim or an appeal, forms, and then you can search in the search bar for something else you might want to look for. Okay, that's Medicare.gov. Now, if you want to use it to get a plan, or if you want us to help you get a plan, you need an account. So you go to this button that says log in, create an account. And up here in really tiny letters, it says create an account. So in order to create an account, first you need your Medicare number. And how do you get your Medicare number? When you're ready to sign up for Medicare, you call Social Security and you tell them you're ready to sign up. And if you don't already get a Medicare card in the mail, they will send it to you when you sign up. So you really need to leave enough time to start that process several months before you're going to go on Medicare. Now, if you don't want to do this, we can go back and we can do find health and drug plans. And this is what we do when you call us. So when you click this, it says log in or create an account like we had on the other page, or you can continue without logging in. Now, the advantage to logging in is that the information that you put in will take us to your particular page in Medicare, and it will give us information about you, and it will store all of your drugs on your page. And it's very helpful to be in your account when you want to get a plan. But we're not doing that right now. I'm going to just give you an example of how to continue without logging in. So the first page is they want to know what you're looking for. So you want to tell them whether you're looking for an Advantage plan or a drug plan, or I wouldn't check off any of these for Medigap because you can't really get a Medigap on this tool. What you need to do is call a broker, and I can talk about how to find a broker who will sell you a Medigap and will not charge for your services, for the services. So most people either want an Advantage plan or a drug plan, and it goes pretty much either way the same. So let's say you want an Advantage plan. I said it has to do with what county you're in. So let's continue in this Mount Airy. And then it wants to know if you're getting any of these low income programs, because when we look up on the tool how much you're going to pay for your medication, it depends whether you're in any of these programs. So you can say, I'm not sure, or I don't get any help. And of course, you want to see the costs. That's why you're here. And then it asks you if you could consider mail order, because sometimes mail order is cheaper, but some people get their mail stolen from their mailbox or from their stoop, and so they can't. So you would say that if you want to just go to a pharmacy, or if you want to look at the prices for both, let's just say both. And then we get to the pages where we're going to put in the medicines that people would be using. So does anybody want to shout out a medicine to me? I'm going to put in Lipitor. A lot of people are on Lipitor. So then you put add the drug, and it tells you that there's a generic, and you say, sure, I'll take the generic. And then it wants to know what dose you're on. You select a dose and how many pills you take each month, and then you add it to the drug list. And then if someone's on metformin, again, you add the drug. Well, we tried to add the drug. We have to select it. I'm sorry. Here we go. And then you add it, and then you choose the dose, and how often you take it, and you add it. And then we can look at some more
Lisinopril.
lisinopril. There you go. Usually after you put the first few letters in, it pops up. You click it, you pick your dosage. And then let's try some of the fancy new drugs that people are getting these days, like Januvia.
Might not let you add that if you have metformin in there.
I'm going to tell you it's letting me add whatever I want to add.
Okay.
You have another drug you'd like to suggest? Anybody want to name a drug? Let's look at Synthroid. That's a thyroid drug. Again, it says there's generic that's available, and you put your dose and how many times a month, and that's it. So let's say this is our drug list. Now, if this was your drug list, it's not going to stay here because we're not on your page. But we're using this as an example. So now we're going to say we're done adding drugs. Then we're going to say we're going to add pharmacies so we can compare the prices at the different pharmacies. So we're going to compare them to mail order. So let's say Save On. I'll choose all the big ones, CVS. Now you can see there's only 4 pharmacies that pop up. That's because we say within a mile of where we live. So let's go to 5 miles. So now we get, let's see what else we get here. We get a Walgreens. That's a big one. We get a ShopRite. ShopRite is very good for diabetic drugs. And the good news is this year, people's diabetic supply, their insulin is being capped at $35 a month by a lot of plans. So that's a big savings for people. So there are 59 Medicare Advantage plans available. And how do we choose? So we want to know what the ones are that have the lowest drug plus premium costs. So they're going to start from the cheapest. And if you're a person that has Medicare and Medicaid, there are special plans that you can get. And if you want to add them, you just click this button. So here they come. So for this person, the cheapest plan is this Clover Health Choice PPO. Now a PPO is like an HMO, only it has a bigger network and usually doesn't require referrals. So this person could get a Clover HMO plan for 0 monthly premium, no deductibles. It would give you glasses, dental, hearing, transportation, fitness, telehealth, and an allowance to buy over-the-counter stuff. And 0 copay for your primary and $15 per visit for every specialist. And it estimates that the total you'd pay for the year at the pharmacy is this much money. And if you want to see how that gets broken down, you would click on plan details. It tells you the premium, your Part B deduction, tells you all the different services, how much you'd pay for those services. And you keep scrolling down and it'll tell you what pharmacies are working with this plan. So if you want to go to ShopRite, you're out of luck. And if you're currently going to Walgreens, you can, with this plan, you can probably do better at CVS. So just quickly, at ShopRite, you would pay $7,000 for your drugs. If you go to Walgreens, you'd pay $667 for your drugs. If you go to CVS, you'd pay $443.86. Save On is the same. And this is for the year, and it tells how much each drug costs, what you're getting charged for. This person is only getting charged for Januvia, $40 a month, which if you got it at the drugstore, it's going to be a lot more. And mail order would be only $332 a year, but you have to be sure you can get your medications. And mail order automatically gives you 3 months supply. All these other pharmacies will give you a 3-month supply if you ask for it. And so that's what we do. We go down the list. Now you saw that this plan is not on my highlighted list. It's just purely a local plan. So people are out of luck if they travel. So we would look, so here's a good national plan, but again, let's see. Well, so for this plan, oh, that's an Advantra plan. So you don't have any deductibles. You still have a pretty low annual rate for your drugs. It gives you all these benefits and charges you $0 copay for your primary and $40 for specialists. So this is what we do. We go down the list. We find something that's in the cheaper drug costs, because you can go and get higher and higher as you go down the list. And we find the ones that have your doctors that you want to keep in their network. And that's how we do it. And then after we look at the plan details, we go to this enroll button and we can enroll you right here from the screen. It's very similar if we do a drug plan. We put your drugs in, we look at the different costs for the different plans, and we can sign you up right from the screen. And that's how we do it. Now we have another tool. We still have some time. So let's go back here. I got to wait for that to go away. All right, if you're looking to buy a Medigap plan, you need a broker who's not going to rip you off, because you don't pay them, but they get paid by whatever plan you buy. So it's a tendency sometimes, if you're not really working on behalf of the patient, to sell you a more expensive plan. But this is a website. It's called Medicaresup.org. And I got to go back a couple pages. Medicaresup.org is a group of brokers. Brokers means they work with a lot of different insurance companies. An agent just works with one company, and if they don't sell you something from their company, you've wasted their time. A broker works with a lot of different companies, and he or she can comparison shop for your Medigap supplement, because once you get a Medigap, it's not easy to change. So you would go to Medicaresup.org. You would click on Find Local Agent, even though they're brokers. And then you get to this page, you scroll down and you put your zip code in and you click. And they're then going to print you out a list of brokers who are licensed to sell Medigap in your zip code, even if they live in Windmore or Conshohocken or Cherry Hill. Once you get this list, you can call any of the people on this list. They have sworn to work in your behalf. You look to see somebody who looks reliable. You call them. They don't have your number. You haven't entered your number. You've just entered your zip code. You call them and you say, I'm interested in a Medigap. I would like an illustration of what it would cost me. And they go to this tool, which we have because we're APPRISE. We get it from the Pennsylvania Department of Aging. And the way this works is, whoops, sorry. We have to go out of this and go back in and start again. And this is what the brokers use. So you say, I want a quote of what this will cost me. So this is what they do. They ask for your zip code. And they ask you how old you're going to be when this starts. So if you're just turning 65, this is it. If you're on disability, you're under 65. You might stop working when you're 74. So they look at this because prices depend on age. And they ask you the only question they're allowed to ask, which is, do you smoke? And the answer is either yes or no. The answer is never, I stopped last year. You don't tell them that. It's none of their business. Then they want to know when you want it to start. So let's say April 1st. They want to know if you're a man or a woman, because men, for the first time, are paying a little more. And then what plan are we going to look at? So we're going to look at the G plan. So we're sorting them by price, and I'm going to explain this to you. So if you see a pair of Gucci loafers at the Gucci store, you're going to pay maybe $1,000 for them. If you go to DSW and you see the same exact Gucci loafers, you'll probably pay $250 for them. These are just made up numbers. But the point is that all of the G plans are going to give you the same exact benefits that I showed you on that chart before. But the difference is that this company is going to charge you $132 a month. And this company is going to charge you $236 a month, the same benefits. So we want the ones that are the cheapest and that have an A or an A- rating, or an A+, that's possible too. So when we tell people this 65-year-old woman who lives in Germantown and doesn't smoke, her G plan should cost her somewhere around $130 something a month to begin. And they go up a little bit every year, so you want to begin at the lowest price. Again, if you want to look at the N plan, the N plan, as I said, is going to be about $30 less than the G's. So here you can get an A-rated Aetna plan for under $100 a month. I wouldn't get a B+ or that. Here's an A- plan for 103. Here's another A plan for 103. So you know that you should be looking around the $100 a month mark for an N plan. And then these brokers will sell you the plan, and some of them have a household discount. Some of them have a policy fee. That's a one-time fee. These are all the details that we don't need to talk about, but essentially that's how you would get a Medigap. The drug plans we get for you on the computer, the Advantage plans we get for you on the computer. And that's my story. And if we were taking questions, we would have time for lots of questions, but you can call me. Yes.
Does the person calling you have to have a computer and the internet in front of them?
No.
Okay.
We can do this on the phone. If it's on the phone, I usually try to send them some of the key materials like the plans and the introduction to Medicare. I usually send that by snail mail. Some people have been getting it. Some people have not received it in 2 weeks. That's why we call it snail mail. And now it's the snail's infected by COVID and it's even worse. So, but certainly if they have an email address, I can send them materials by email. And if they're able to Zoom, I do a one-on-one Zoom meeting, or maybe sometimes if we have a trainee, there's another person on, or the husband or the wife, whatever, we can do it by Zoom. And of course, it's a lot easier if you can see it and, you know, we can talk about it together. But the second best is that I send you the materials and you follow along while we're talking.
Great. Thank you so much.
Any other questions? B, do you have any questions or things you think I might have forgotten to mention?
I don't think so.
As I said, there's also, you know, high income earners have to pay a little more for their Part D and their Part B. Yes.
Yeah. When you were going over the Medicare Advantage plans, and you were talking about how networks vary, and you said, I thought you said that you could help people find out if their doctors are in network. And I thought that was something that was very difficult to do and that we had to do on
Yes,
our own.
I don't help them do that. I tell them if they have doctors that they like, that they want to keep, they need to call their doctor's office and ask their doctors if they take that plan. Because the minute something is posted on the internet, like a list of doctors that are take Aetna, the next week that doctor may decide not to take Aetna, and that list is not worthwhile anymore. And in fact, I just got somebody who called. They were signed up by some agent who was selling one company. They signed them up. They swore, of course they're going to swear, that their doctors were taking the plan. And the minute they got their card, they called their doctor, and the doctor does not take that plan. So I leave that up to the clients to call their office, because the office knows what they're taking and what they're not taking. And that's the best way to do it. But we help people along with this. And actually yesterday I had to call an office for somebody because some people are better at speaking for themselves than others. So I called an office to find out what plans they were taking out of what we were considering. And I helped them with that, but usually I don't do that.
Great. Thank you so
Okay.
much for joining us and
So
sharing.
yes, and again, I'm just going to share my phone number
Mhm.
and my name for anybody that wants personalized counseling. And again, this is the Einstein office, but none of us are in the office right now because we're sitting at home avoiding COVID.
Right.
So you can call me directly for counseling, or if you want me to send out materials.
All right.
And that's it.
Thank you so much.
You're very welcome.
Take care.
Bye.